Okay, I think it's time to get started here this afternoon. Thank you.
Mr. Chairman, you vote for me anytime.
Good afternoon and welcome to the Education, Business, and Administration briefing of the Maryland Family Network. Laura Wheeldryer, the Executive Director, is here. Come on up to the table. And anyone else, if you're bringing anybody else with you, do that. You can do
I
that.
think you just got me for today.
Okay, we'll take it.
I'm glad. Good afternoon. I'm Laura Wheeldryer. As Senator King said, I'm the Executive Director of Maryland Family Network. Thank you so much for having me here today. And of course, special appreciation to Senator King and Erica Schisler for making this happen. Thank you. My goal today is to give you a quick overview of some of the research that helps inform early childhood policy and some related resources to early childhood that you might find useful as you consider various bills and long-term goals of the General Assembly. You may already know that early childhood is the most important 5 years of our lives. The brain is developing faster than at any other time, with more than 1 million new neural connections formed every second. Maryland Family Network is here to make the most of those early years. Our goals are to ensure every child has strong families, quality early learning environments, and a champion for their interests. The document that I'm going to be talking from today is called the ABCs of Early Childhood, and we developed this document and update it regularly to help legislators and policymakers and others who care about positive outcomes for young children to have all the resources they need at their fingertips to make informed decisions. Next slide, please. So the way this resource, which is online and also available if you would like a copy, we can make one for you, depends on your choice of reading styles, but each section of the ABCs of Early Childhood focuses on a separate topic area, and each section begins with a one-page overview and then followed by multiple pages with more detailed descriptions and authoritative source material like key studies and important research in the field of early childhood. The very first section is called The First 5 Years Last Forever, and this is about the decades of ever-growing research that confirms the vital importance of high-quality early child care and education. This is the kicker. The single greatest factor determining a child's success in school and later in life is the quality of his or her experiences from birth to age 5. That's before they ever enter the public school system, before they're ever in a formal classroom. Those years from birth to age 5 constitute the most expansive period of brain development and learning. In fact, 95% of brain growth takes place before the age of 6. And when we're talking about brain growth, what we're really talking about is developing the foundational capacities that set the stage. And that stage will either be fragile or it will be sturdy for all later learning and functioning. And that's why we're here. Children who experience abuse or neglect are at risk of not experiencing healthy brain development and failing to acquire necessary skills and abilities. You've probably heard of ACEs, adverse childhood experiences. The impact of ACEs can last well into adulthood. This has been documented through much public health research. Language acquisition, self-regulation, and social competence are among the critical school readiness skills that children should develop between birth and age 5. Maryland's current system of early care and education is not equal to the task of reliably promoting learning, healthy development, and school readiness for all children. There really isn't a system at all, but there could be. So you already know, as legislators, that a system immediately sounds like it's going to take money. So we're going to talk about that in Section B, about the dollars and cents of investing in early childhood. We have an estimate from a Nobel Prize-winning economist, James Heckman, that shows that high-quality early childhood programs for disadvantaged children can yield a 13% return on investment per child per year. And the reason why is because they produce and promote better education, economic, and health outcomes, as well as reduced social spending. Also, the Center for the Developing Child at Harvard estimates that there is a $7 return for every $1 invested in early childhood programs. These are, by the way, far better odds than you'll get with sports betting. There's a prominent longitudinal study that suggests children who have access to high-quality early learning programs are significantly more likely to be employed, uninvolved with the criminal justice system, become high school graduates, and high earners when compared with their peers who did not have access to high-quality early childhood programs. And so to bring it home to Maryland, I ask you to consider the investment we're making in the blueprint for Maryland's future. No matter how much we invest in K-12 education, and I'm a huge fan of investing in K-12 education. I have to say that because my husband is a principal. So I would never want to dissuade you from that, but are schools going to be set up to achieve the audacious goals in the blueprint if we are not ensuring that every child shows up in pre-K or kindergarten having had every advantage during these critical first 5 years? Next slide, please, Beth. Every year, Maryland Family Network produces a report called Child Care Demographics. This is a compilation of data related to young children and their families. So in this report, we look at a ton of data and sort of connect the dots, including child care supply and demand, household income, the cost of care, housing information, and more. We present the data as a whole for the state of Maryland, but we also produce a report for each of the state's 24 local jurisdictions. And I mention this because this has proven to be MFN's signature report and an invaluable resource for legislators for many years. Next slide, please. Section D tells us where to find Maryland's young children. So this is one of those conundrums of early childhood. Unlike 5 through 18-year-olds, we know pretty much where they are or where they're supposed to be. The same cannot be said for early childhood. They are all different kinds of places. We surveyed working parents across Maryland and looked at the child care arrangements for all children age 5 and under. So I've already said this, but there is no formal child care system in Maryland. And while we've made great strides in recent years to offer a lifeline to child care providers, they still need more help. This is especially true in the wake of the pandemic, in which we saw many providers close their door for good, and we are now seeing emerging child care deserts in the state of Maryland. It's hard to compete when Royal Farms or Amazon is offering $20 an hour or tuition reimbursement and health care benefits. Ask yourself, if child care went away, where would these children be? Many of them would be in unsafe and unregulated care situations for hours a day and falling behind their peers. Just a word about the slide. The difference between these two charts is that the one on the left includes pre-K and K, since we're looking at all children 5 and under. Some of them are obviously in a public school setting. The chart on the right does not include pre-K and K. So we wanted to give you a sense of the spread with and without the public schools as part of the puzzle. A quality early childhood education system must first be an equitable one, and Maryland is not there yet. There have been enormous gains in recent years, thanks to your leadership, but there is still a lot of work to be done before every child has what they need to get a strong start in life. So here are some startling and grim statistics that play into why investment during this period is so critical. 1 in 8 Maryland children under age 6 live in households with incomes below the federal poverty level. There are significant racial disparities in infant mortality and maternal mortality, meaning Black babies die before their first birthday at more than twice the rate of white newborns, and Black women die at more than twice the rate of other women during pregnancy and childbirth. In addition, less than half, 47%, of children assessed in Maryland demonstrate kindergarten readiness across 4 learning domains, and none, 0 counties, currently meet the long-term goal of more than 64% of children demonstrating readiness. So we have a state with many resources and a lot of wealth, but these are, in 2023, startling statistics to grapple with and shows how far we have to go. Next slide, please. These are links to, I think you all have copies of this. These are links to some of the reports that we have on our website. Many of the statistics I just cited in the slide about equity come out of our Maryland's Prenatal to 3 Equity Report. These are other examples of reports we produce that could be useful to you. We try to point out where gaps are, but also where successes have been. And of course, we would love the opportunity to talk more with you about any of these. So looking ahead, you have a link if you want to download the ABCs there. Where do we go from here? In many respects, that is up to you, of course. We look forward at Maryland Family Network to building this year on the successes of last and previous years. Last year, we had an amazing comprehensive child care package of legislation. We passed time to care, paid family and medical leave, which has a huge impact on young children and their families. And obviously, we're all committed to the implementation of the Blueprint for Maryland's Future. We would always love to hear your thoughts and ideas and be partners with you in thinking about how to solve some of these complex social issues. Just to make it very current, I want to end with some survey data that is, as they say, hot off the press. We surveyed parents across the state of Maryland between October 26th and November 18th, just this past fall, in both English and Spanish. And we are going to publish these results, but you are getting a sneak peek at them. We got over 3,500 responses, 3,000 of them in English, and rough numbers, almost 600 of them in Spanish. We have checked and made sure that they are representative of families living in urban, suburban, and rural communities across the state of Maryland. And we asked parents about childcare. And why did we do this? Because there's so much we don't know about what's happening with childcare post-pandemic. During the pandemic, many childcare providers were closed. Some have never reopened. We know that childcare is still under-enrolled, but we think it's because it's so hard to staff that there are many classrooms sitting empty without adults in them. And also people's work arrangements changed during the pandemic. Some people are going to work from home forever now. So maybe they made arrangements during the pandemic that they haven't, gone back to formal care. We don't know. The dust is still settling. So part of what we were trying to do is twofold. One, to just get a handle on what's happening for families with childcare. Where are those children? And second of all, what is the experience with child care scholarship program? So I'm just going to share a few statistics. I'm glad you're all sitting down because I don't want to shock anybody, but childcare is very expensive. That is the headline takeaway from families who completed this survey. But I think the real shocker was how they answered the questions about what they're doing to pay for childcare. Almost 1/3 report taking out payday loans to cover the cost of childcare, which is I'm sure I don't have to tell you, a vicious cycle of debt and high interest rates. And, I don't think any of us would promote that as a good strategy for paying for a regular expense. But beyond that, 38% of families said they're juggling regular household bills to cover childcare. 1 in 5 families reports using credit cards regularly to pay for childcare. We had families who said they have to give up on things like paying utility bills, buying clothing for their children, fresh fruits and vegetables, and even struggles with paying for housing in order to afford childcare. Because we were lucky enough and did a lot of outreach to ensure that we got a lot of Spanish-speaking families completing the survey, we were also able to look at the surveys by home language. And the results were not great overall, but if you pull out the results for Spanish-speaking families, they were even more striking and dramatic. Half of Spanish-speaking families reported delaying or skipping regular checkups, dental work, emergency medical care, and filling prescriptions. Spanish speakers were also more likely to apply for child care scholarship and more likely to struggle with getting approved for child care scholarship. This is important. One, you all have done an amazing amount of legislation and really shown national leadership on improving Maryland's child care scholarship program. We've gone from one of the worst as recently as 2018 to one of the best in the country. It is our largest public investment in child care. It has to work. It has to work for parents. It has to work for providers, or else it won't work for children. So this was really, really concerning that all the parents reported problems with accessing child care scholarship, but Spanish speakers reported astronomical issues, lost paperwork, unreturned phone calls, documents provided in English only, and a very confusing bureaucratic process. Again, child care scholarship is supposed to make child care an easily accessible service and support families who are working or going to school, but instead it is slow, bureaucratic, and often impedes parents' abilities to work, and this really has to change. You may know that last year we also surveyed providers and actually held a couple of town halls with child care providers from all over the state. And we heard many of these same issues with child care scholarship echoed, and real fears about the future of the industry and individual women's future in the industry as a whole. So I think it is fair to say that the system, or what there is of a system, is really broken. It's a broken business model, and we have the ability in Maryland to do better. The last slide is just contact information. If you want to follow up on any of this or talk more, you have the ability to reach me, Clinton McSherry, our Public Policy Director, or Beth Morrow, our Assistant Public Policy Director. And I'm more than delighted to answer any questions you might have.
Thank you very much. I just have, I struggle with whether we should put more resources into like 2-year-olds, because they need that developmental program so much, but there are only so many dollars to go around. Do you put that money into the younger kids, or do you put more money into the 4- and 5-year-olds?
Well, it's a tricky question to answer since we are currently investing a lot of money in 4- and 5-year-olds. I think, and I know you love it when people say it's complicated, but it is complicated.
It is complicated,
To
yes.
think about early childhood as an ecosystem, and that there's the possibility that there might be unintended consequences of the ecosystem getting out of balance. So as pre-K expands, we know this from other states that have implemented diverse delivery of pre-K. You kind of tilt the ecosystem towards serving, in this case, 3- and 4-year-olds. So you have the potential of 3- and 4-year-olds being pulled out of private childcare. 3- and 4-year-olds basically subsidize infants and toddlers in childcare. And so in New York City, for example, we've seen lots of exploding childcare deserts because of the tilt towards serving pre-K students, which pays more than private childcare does. So I think a lot of states have used ARPA dollars to try and figure out this issue of balancing the investment. And so there are things the state could consider, like contracting for infant and toddler slots to keep them whole and present, even if they go perhaps a few days unfilled in between transitions. But to keep providers serving those numbers, it could be done through a mechanism like child care scholarship.
I've just heard many, many times, and I've had this debate 1,000 times over my career. My kids all had the 3-, 4-, and 5-year-old preschool classes before they went to kindergarten, and the difference between the kids that have had those services and the kids that have had no services, and there, a lot of educators tell me that they all catch up and they're all even by the time they're in 2nd grade. I just still never believed that.
No, I don't. I'm pretty sure there's a lot of research that says that.
Yes, and I just still am big believer in getting them as many tools as they can to keep up at such a young age. But
I totally agree.
thank you for all you do. Are there any questions from the committee? Comments? I think we're good. Thank you very much.
Thank you so much. I appreciate your leadership.
I'm sure we'll be seeing you again.
I certainly hope so.
Thank you. Okay, that ends it for us, folks. We'll be back here at 2 o'clock for committee.